So there are instances where your patient will not be patient, and the onus is on you as a professional, whether you're a nurse, a doctor, you're a carer, to remain calm and remain professional and be patient with your patients. So that sounds like a nursery school rhyme, isn't it? Be patient with your patient. Just last week, a student was asking me that could that be the reason why they are called patients? It's important to be able to deal with challenging situations at work, dealing with difficult patients. So in this video, I'm just going to share with you my own personal opinion, my personal view, perspective, and advice on how you can deal with difficult patients. At one point or the other, whether you are just starting off your career or you're an experienced professional, there will definitely be those moments where you feel emotionally overwhelmed, you feel triggered, then those negative emotions keep coming up to your mind when you have difficult service users in front of you. First off, I don't like the word difficult patients. Naturally, I don't like seeing any patient as being difficult. I would rather see them as patients with difficulty. Okay, because if you've not walked in another person's shoes, you cannot judge them. Okay, so what you are saying as the person you are saying as being difficult might actually be dealing with something that you are not aware of, and that is where the discrepancies come in. So when you tag them difficult patients, as it were, it makes it look like you're already judging them, you're already boxing them to a corner, you're drawing a conclusion that this person is a difficult patient. And unconsciously, that affects the way you react to the patient. It affects the way you approach this individual, and gradually, those emotions start building up. But for the purpose of this video, I'll be talking about difficult patients. Difficult patients, they are defined as those service users who elicit strong negative emotions from the professional, maybe the doctor or the nurses. Okay. And if not acknowledged, if not well managed, these feelings can lead to diagnostic errors, can lead to health and safety issues, can lead to unpleasant confrontations, can lead to troublesome complaints, even legal claims, and it can even land you in prison. It can even bring your career to an abrupt end. Okay. Just a bit of digression. I'm sure it's already in the news. Recently in the UK, there are 4 Nigerians who were sentenced to prison, okay, for roughly handling a particular service user in a care home. Okay. I understand these people were not professional nurses, they're not professional carers, as it were, but it makes it worse when you don't have the adequate training. You just feel, okay, I can do the basic nursing care, I can do the basic things that nurses do or that carers do, but you don't have the enough professionalism in you to deal with challenging situations. And if you are not careful at that point, those negative emotions, very strong negative emotions, can find their way out from you, and you land yourself in trouble, just like these guys. So before I move on to how you manage it, there are few reasons or few predisposing factors to difficulty in patients that can make a patient to come across as being difficult. Okay. So you might have a patient that is naturally defensive. You might have a patient that is extremely anxious. Okay. It could be fear, it could be anger. Okay. Some might actually have experienced poor treatment in their previous visits, or they feel they are not being treated with dignity and respect. Okay. Some are just demanding. Okay. You might have situation of maybe hysteria. A whole lot of things can make a patient to come across as being difficult. And if you add medication or disease condition into the equation again, it makes it worse, because there are actually some medications that could make a patient to be acutely confused or drowsy and agitated, and that makes it more difficult. Okay, there are disease conditions as well that could make a patient to be confused, to be agitated. Okay, so if you bring all those things together, we have a difficult situation at hand now. So the onus is on you as a nurse to try and handle this situation with professionalism, empathy, and due diligence. Okay. So the first thing I'll say is establish, is it you or it is them? Okay. Establish, is it you or is it them? Okay. It's very easy to attribute the difficulty to the patient. Very easy to. When I was training as a nurse, there's this joke we always say that one of the good things of being a nurse is you can be on the ward, you can fart and blame it on the patient. With this difficulty as well, it's very easy to attribute it to the patient. But we have to acknowledge that even ourselves as professionals, we have our own unconscious bias. We have our own internal bias. We have our own internal struggles. Okay. You even to as far as fatigue, okay, fatigue, anger. Okay. You might even be transferring aggressions. Okay, maybe you have issues with your partner, or you have issues with whoever you have issues issues with. Okay, you have tendency of already nurturing that negative emotion before coming to work and transferring that on your service user. Okay, you might not be happy on the job. You might have issues with your manager. Okay, you might probably recently been reported by another patient or maybe a colleague or anything. You might even be under investigation. Okay, and those things already build a level of emotion inside of you. And if you are not calm enough to acknowledge them and deal with them, it could lead to a challenging situation for you. So first thing is, it's not always about the patient. It's not always about the patient. We need to look inward ourselves and understand that the trigger, the cause of this situation might actually be from us. So it could be me, that I'm not treating the patient well, maybe the way you are speaking, okay, or maybe your bias, or you are just stressed and frustrated, okay, and you are just letting it out on the patient. First thing first, it's not always about the patients.
Okay, sorry to interrupt you. You know, there is a place in the Bible where Joshua had to ask the question, are you for us or you are against us? Are you for us or you are for our enemies? Now it's time for me to ask, are you for me or you are against me? Have you subscribed? So if you've subscribed, let me know in the chat box. Tell me you have subscribed. Just say yeah. And if you are yet to subscribe, what are you waiting for? Subscribe. We share helpful information for you that can help you with your career progression, career professional development, and your day-to-day life. We share experiences as well. So put on the notification bell so you can be notified of any new content. Thank you everybody, and I'm going to see you again in my next video. Cheers.
Everyone naturally will respond to their level of information.